Did you know that over 1 billion people living in endemic areas are at risk for infection of this disease? What is it, you ask? It's called Leishmaniasis. Leishmaniasis is a parasitic disease that is found in parts of the tropics, subtropics, and southern Europe. Leishmaniasis is caused by infection with Leishmania parasites, which are spread by the bite of infected sandflies. Are you at risk for Leishmania? Sandflies can bite and infect people of all ages. Sandflies are found in the tropics, subtropics, and southern Europe. The flies are usually in more rural areas rather than urban areas, and the flies are most active from dusk to dawn. So if you're planning to travel to an area with sandflies, or are a Peace Corps volunteer, a missionary, a soldier, or other person doing research in these areas, you could be at risk for infection. What if you are bitten by an infected sandfly? If you are bitten by an infected sandfly, it could result in two forms of Leishmania: cutaneous or visceral. Cutaneous develops within a few weeks or months of a sandfly bite, and visceral develops within months or sometimes years of a sandfly bite. What are the signs and symptoms of Leishmania infection? Both cutaneous and visceral Leishmania could be silent infections with no symptoms. If symptoms do appear, however, it could be in the form of sores on the skin for cutaneous Leishmania, or a fever, weight loss, enlargement of the spleen or liver, abnormal blood tests, or low blood counts for visceral Leishmania. So how do you prevent Leishmania infection? Currently, there are no vaccines or drugs to prevent infection. The best thing you can do is decrease your risk of being bitten by an infected sandfly. If you are outdoors, wear clothing to minimize exposed skin. Things like long sleeve shirts, long pants, socks, or hats are best. Also apply insect repellent to exposed skin and clothing. If you are indoors, stay in well-screened or air-conditioned areas. You can spray insecticide in the living and sleeping areas. If you are not in a well-screened or air-conditioned area, use a bed net to minimize the risk of being bitten. As for the community, this health department is working to increase vector control by using a World Health Organization recommended pesticide to decrease the sandfly population. Most vector-borne diseases can be prevented by vector control if it is implemented well. So from 8 p.m. to midnight, the local health department will be spraying the designated areas. These areas will be marked with signs, so make sure to vacate the premise by 8 o'clock. The health department will also work with the sanitation department and government officials to plan and manage future vector control for our city. If you think you have symptoms of infection or have traveled to an area with sandflies, please reach out to your healthcare provider for testing and treatment options. Remember, the key to minimizing the risk of being bitten by an infected sandfly is to take precautionary measures to minimize exposure to sandflies. Thank you. This has been a public service announcement from your local health department.